This audiobook aims to help midlife women navigate through the challenges of living with newly diagnosed ADHD, since it is a journey I have recently taken myself. It turns out that men and women have very different symptoms with this disorder. To summarize, boys act out, females internalize. While boys manifest their ADHD in hyperactive behaviors, in fact, the disorder was thought to only affect boys in the early 1970s, when it was known as hyperactivity syndrome. Girls contend with anxiety, depression, demoralization, and self-esteem issues. For women, diagnosis often comes much later in life, when we can no longer cope on the job or in relationships, with increasing problems in working memory, executive function, which helps us with long-term planning and goals, and alertness. So much has been discovered about ADHD and girls and women in just the last 10 years. In 2000, says Dr. Patricia Quinn, a developmental pediatrician who founded the National Center for Gender Issues, there were only 20 published studies that looked at girls and women with ADHD. Luckily, that's all changed. This is partly due to the work of pioneering doctors like Dr. Quinn, who has ADHD herself, and groundbreaking psychotherapists like Sari Solden, who brought women separate and distinct issues with ADHD to the forefront when she published Women with Attention Deficit Disorder in 1995. It's now believed that the majority of girls and women have the primarily inattentive type of ADHD, ADHD-PI, as opposed to the hyperactive type. However, girls' struggles with internal distractibility and not feeling smart, which often manifests strongly in the college years when we are on our own for the first time and lack structure and parental monitoring, have serious consequences in our lives after college. For girls and women who aren't medicated, who don't know they have ADHD, or sense something is wrong with them but don't know what it is, there is a very real and sobering effect as they go through their 20s and 30s. As Patricia Quinn says, girls and women are painfully aware of their weaknesses, but they think it's their fault. 10 or 15 years after college, ADHD women may be wondering what happened to their lives. Some may go through job after job. Some may stick at one job but feel plodding and unacknowledged there. Many will struggle with comorbidities such as depression, bipolar disorder, OCD, substance abuse, and so on. Relationships are frayed. There is a proven connection between having ADHD and being seriously in debt. Women struggle in particular with clutter, hoarding, organization, filing taxes, cleaning house, keeping their kids under control, and so on. Studies have shown that people with ADHD are significantly underpaid over their lifetimes, about $10,000 a year. Yet, coming out at work as a person with ADHD is not recommended by therapists. There is still a strong stigma attached to the disorder, and it's not an official disability. Self-awareness is key to change. I consider ADHD a very hopeful diagnosis, says Dr. Quinn, a woman in her 60s who should know, as several of her children also have ADHD. Finding out what's wrong is the key to making things better. Quinn advocates self-knowledge, but there are significant, real barriers to women discovering that they have ADHD. Money is an issue. The psychiatrists who evaluate and issue prescriptions for ADHD in the U.S. generally do not take insurance. Shame is also an issue, of course. No one wants to be told conclusively that there's something wrong with their brain, especially if they've worked diligently for many years to function like everyone else.